Welcome back to the Women's Heart Health Solution. I'm your host, Dr. Mark Menolascino, Medical Director of the Meno Clinic Center for Functional Medicine in Jackson Hole, Wyoming. This is your chance to listen to the world's experts talk about how to achieve optimal health, optimal vitality, and prevent heart disease for all women. We're very fortunate today to be joined by one of the world's experts, Dr. Anna Cabeca. Thank you for joining us, Anna.
Thank you for having me, Mark. It's great to be here. What an important topic to be discussing.
Well, thank you again. And you're one of the people I look up to, that I always turn to for the tough questions on women's health. And it's always nice to have a triple board certified physician, not just a physician, but a triple board certified on our team. Let me brag about you a little bit to our viewers. Dr. Anna Cabeca is an internationally acclaimed menopause and sexual health expert, a global speaker, and a pioneering promoter of women's health. She is Emory University trained and is triple board certified in obstetrics and gynecology, integrative medicine, and anti-aging and regenerative medicine. She's also the author of The Hormone Fix, a diet and holistic lifestyle program for menopausal women. Her areas of specialty include bioidentical hormone treatments, natural hormone balancing strategies, and she's received extensive notoriety for her virtual transformation programs. Dr. Cabeca hosts the highly regarded series Couch Talk, featuring compelling podcasts focused on a wide variety of important health and wellness topics. She was named 2018 Innovator of the Year by Mindshare, the #1 health conference for wellness influencers. She was also honored with the prestigious 2017 Alan P. Mintz Award by the Age Management Medicine Group as the most outstanding physician who displays clinical experience and entrepreneurship and excellence. She's reached hundreds of thousands of women around the globe, inspiring them to reclaim their optimal health and realize they can journey through menopause and find more purpose and pleasure than they ever dreamed before. She balances her passion for women's health with faith, grace, and skill, and is a super mom, raising her 4 daughters and leading a nonprofit foundation she created in honor of her son, the Garrett V. Bivens Foundation, and he tragically died as a toddler. Dr. Cabeca really influences her presentations with humor, raw connection, and passion, and she tries to impact all of her clients' lives every single day. Again, Anna, you're one of the people I turn to when I have questions. I've listened to you lecture, we've talked heart to heart, and I very much appreciate you being here to join us today.
Again, it's an honor. Thank you for having me, Mark.
You know, we've talked in the past about, really how we miss heart disease in women and how we miss the symptoms, and how in menopause and perimenopause, there's a lot of symptoms women have that are either written off as menopause symptoms when they're actually heart disease, or they are given medications for heart issues when they're actually menopausal symptoms. Can you share with us some of the things that you've seen and how one's been talked about with the other, and they might have missed one versus the other?
Yeah, no, absolutely. It's really interesting. And I think it's so key. Women, initially their heart disease gets undiagnosed and treated for other things. So it's really critically important. Not only that, once they're diagnosed, their hormones and sexual health gets put way off the table. I mean, it's not even within reach anymore. And so women get neglected from that aspect after heart disease is diagnosed. But a couple of the key symptoms that I see that can be disguised as heart symptoms, but can also be hormone imbalance symptoms, includes the palpitation, the heart flutter, the heart pounding in your chest, and that symptom, and also discomfort. We can have discomfort in our chest just because as our fascia ages too, we have those constrictions as well. So the heart palpitations is a big one that women end up in the emergency room. They're put on a beta blocker, which is going to drive up their glucose and insulin and become more insulin resistant, increase the risk of metabolic syndrome, increase the risk of heart disease, when sometimes it's, when we look at the functional medicine approach, maybe it's magnesium insufficiency, maybe it's progesterone insufficiency, and let's go on from there to look for the underlying reasons.
Are you telling me that you can help women with palpitations by giving them magnesium and progesterone?
Well, one thing I check, absolutely. One thing that I check always is red blood cell magnesium. And we want to look at the red blood cell magnesium, not the serum magnesium, which and optimize that level. And the same issue with restless legs. There's other things that we're going to do as well but that is one very easy and expensive intervention. And the other thing is progesterone. Because with progesterone is a neuroendocrine hormone. It affects our nervous system as well as our muscles and our, the precursor hormone for SOMAT, healthy brain, breast, and bone. So those big things. But often when we're in that estrogen dominant phase and with low progesterone, the heart palpitations can be a symptom of that.
There was a government study published about 8 years ago that showed up to 60% of Americans are deficient in magnesium. And a lot of them try to do it on their own will end up with that magnesium oxide that can cause diarrhea. So they'll try to treat their palpitations, they have to treat it for diarrhea. There's different flavors of magnesium, and which ones do you like for restless legs, for palpitations, and for your women patients?
Yeah, I'm really big on magnesium because we know that it is involved in over 300 processes in our body, right? But also, for brain health as well as a cofactor in so many of our, in our metabolism and our metabolic reactions. So I use magnesium L-threonate because it does cross the blood-brain barrier, and that's really important for decreasing anxiety, agitation, irritation, which is also part of this perimenopausal and menopausal hormone flux, and also for restless legs. So magnesium L-threonate and magnesium glycinate, chelated magnesiums. Yeah.
Well, that's where this expertise is so powerful, Anna, that you've learned and that you share, is that magnesium is not magnesium. You mentioned the threonate with a TH for the brain and the glycinate for the heart. It makes a crucial difference versus the magnesium oxide. And then doesn't the quality of the supplement make a difference too?
Absolutely. Yeah. And what's it wrapped in? What's it being served with? What are the other ingredients that's in this capsule that we call magnesium? 100%. Yeah.
Well, you talked about beta blockers. We had a woman last week that was put on a beta blocker for palpitations in her age 20s. Now, 30 years later, hitting menopause, she was having blood sugar problems, energy problems, mood problems. And you have to slowly taper those medicines off. You can't just stop them. But she's been off of it, using the magnesium glycinate, no palpitations, and her energy is coming back, and her blood sugar is lowering. We were talking the other day with another guest about how the cholesterol drugs can cause diabetes in women based on data from the new Women's Heart Initiative reformatting. Can you share with us the whole Women's Health Initiative study, what it told us, what it didn't tell us? I know that's a huge question, but what are your takeaways that you share with your clients?
Oh my gosh. Well, I tell you, in research, Mark, I did research before I went to medical school. So I've always had this research brain. So at Emory University, when I was an OBGYN resident, I participated actually in the HERS trial, which was the initial heart trial looking at, estrogen replacement, hormone replacement in women with heart disease, right? And so there was that whole big initiative, but again, unfortunately, we're using Premarin, pregnant mare's urine derived hormones, conjugated estrogens, and Provera. So there was that issue there. The Women's Health Initiative was such a great initiative. Would have been great if we used at least an arm of bioidentical progesterone. The Premarin arm showed no increased risk of breast cancer. That's what we were looking at. But the synthetic progestin, not bioidentical, the synthetic progestin Provera showed increase in breast cancer. So hence the study was stopped, I think, 2 years in. And that was early, 2002? When all of this information came out. But what we did see, with hormone replacement, we saw benefits, other benefits, but those were the main risk factors that drew up all the red flags. And it really does stem from using non-bioidentical sources of hormone. They are not equal.
Well, I think there's a lot of confusion out there about what is a bioidentical hormone versus the hormones that you're getting from most of your physicians. And they're really quite different. You mentioned the horse estrogen, the Premarin, I mentioned the Provera. So how do you explain the difference to your clients between the two types of hormone?
Good question. So really, I just say, if we can isolate it from your blood, that's bioidentical to you, and use the same structure compound back to you, that's a bioidentical. When it's not native to you, it's not bioidentical. And so we want to, again, I think Mother Nature always wins. I mean, look at the beautiful scenery behind you. Cannot conquer that, right? I mean, it's a challenge. So can't recreate that. So, just look at, how our nature, dishonoring our own nature, and that just makes sense.
It
Like,
does.
let's do that first.
And what about taking a medication orally versus putting a topical cream on the skin?
So there's several different ways to use bioidentical hormones, and oral hormones. I try to not use oral hormones with the exception of troches that are dissolved between the cheek and gum, like lozenges, and so much will get absorbed through the mucous membranes. A little gets swallowed, but we know there's that estrogen window too for for heart health. And I always had the rule of thumb in my practice, smokers didn't get oral estrogen. Non-smokers over age 50 with any single cardiac risk factor doesn't get oral estrogen, and definitely moved everyone off oral estrogens by age 56.
That's a great rule, Anna. That's really a great personal guideline that I'm going to adopt. Thank you.
You are very welcome. You're very welcome. Good rule of thumb, as soon as it helps. And so kind of moving people, there's benefits and risks associated with oral estrogens, and they increase inflammatory markers. And so we know that, okay, well, oral versus transdermal, transdermal is safer. So if we can do transdermal, vaginal, or even buccal, those are optimal choices.
So there's so much in the media, there's so much on the internet of these sound bites of hormones. And I'm sure, like I do, you have clients come to you with the latest and greatest media soundbite. How do you help your clients wade through that information avalanche that comes about women's health, about hormones, what's good, what's bad? Do you have any guidelines that our viewers can use to try to sift through that? Because if you do, I'll be happy.
I mean, what are we doing?
Just
it's
cut
hard.
through the bullshit. What you need to do,
It is, exactly. Again, it's a researcher. As a researcher, go to reliable sources that you trust. I mean, I think that's it, because we, have the blessing of balancing the art and the science of medicine. That is a gifting, and you have that gifting. And so you balance the art and the science of medicine. So being able to discern truth from hype or myth is really critical. And everyone listening to this is smart enough, right? Able enough to be able to cut through that. Like, don't get caught up in the hype. I remember when in 2002, I'm newly in practice, my third year as a solo practitioner in Southeast Georgia. And I did the Hearst trials. I was part of that research. I've been a big advocate for hormones and sexual health. And so that study just hit. I was like, well, look at what the research said. The headlines weren't consistent with the research findings. And so I would say, if there's some big wave, wait till that settles and listen to someone you trust, ask the questions of someone you trust, and hopefully it's someone you have a relationship with, a provider relationship with.
Well, that's why I so appreciate you joining us, because you're not just an OBGYN, you're triple board certified. You went to Emory, you did research, you're a scientist and a clinician and a mom and a woman's health advocate. You have this—
and hormonal.
You have this package that you relate, but you've done the homework, you've done the work to bring that to your clients. And I encourage all of our listeners, really watch on who's talking about hormones. If it's someone who was an ER doctor last week and now they went to one weekend conference and they're an anti-aging expert, don't look for them. Look for someone like Anna that's got a lifetime of experience with this, because hormones are tricky and you have to make really good decisions based on kind of what she says. With this idea of misinformation, aspirin's in the news right now about whether women should take aspirin, not take aspirin. I kind of go back and forth on that, and it depends. There's a test now that you can tell if aspirin actually works for women. But I think that's one of those recommendations that's just been a blanket recommendation, and we're not really sure who needs what. It's not personalized. Do you have a comment on that?
Yeah, I think it's a tough situation. You think a baby chewable aspirin should be harmless, right? It should be harmless, but we know even one baby chewable aspirin eats away at the the mucosa of our digestive system. So that's not really harmless then, is it? And then what does that expose us to over time? what could we use? So then we ask ourselves, I ask myself, so what could
Yeah.
I use in place of a baby aspirin that might be beneficial? So have I improved, like I would say, nutrition wise, are we keto grain? And that's my big platform. It's let's get get you alkaline, eat you getting alkaline whole foods. Let's work on this. And I always talk about urine pH, not blood pH, of course. And then keto, let's make sure as women have enough healthy fats, but the intermittent fasting to extend us into a state of ketosis so that we're using ketones for fuel. So that combination is key. So are we incorporating that for optimizing our health? Number one, getting enough good nutrition and we're able to absorb it. And secondly is, have we optimized on the essential fatty acids? So what's our EPA DHA ratio? What's our omega-3 fatty acid ratio? If I'm going to give someone something as caustic as an aspirin a day, I should at least know their omega-3 fatty acid ratio, right? I should at least know that. And then thirdly, I would add, well, what is the other thing that I could do? What about nattokinase? If I know that they have markers of hypercoagulability, of increased risk of clotting, right? Then I want to look at their and their markers, their HSCRP is elevated, maybe their SED rate's elevated, or they are genetically at risk for coagulopathy. Maybe I want to use something like nattokinase. So safer.
There are options.
Research, there are other options.
And what I'm hearing you also say, Anna, is that there's times where you really need the tests to guide these personalized decisions. And that's where it really comes in. And I think it sounds like you're using them very efficiently and very personalized versus shotgun testing. We see that a lot. But I agree with you is that if you can figure out for that individual in front of you what their story is, and really that's the practice you run and you work with women, is this personalized approach. Can we shift gears to sexual health? Because I think if there's something that's not done well by physicians, particularly men physicians, it's addressing sexual health for women. And we have a lot of men on testosterone and on Viagra, and the partner's forgotten. So help our viewers really start transitioning into looking at, addressing, and asking for help with their own sexual health.
Yeah. And it's a good thing, to discuss, because oxytocin, the hormone of love, bonding, and connection, and orgasm, is heart healthy. It is anti-aging. There are oxytocin receptors in the heart. And if we can do anything in our lives to improve our heart health, that is to increase oxytocin. That is number one on my checklist. How can I have fun? How can I play? How can I laugh? How can I manage my stress so that I can enjoy this day no matter what, life is facing me with? So I think, let's elevate our oxytocin, number one. And secondly, it's also to realize, and you're absolutely right, you've heard me lecture on sexual health. And I always lecture, for our age management colleagues or anti-aging colleagues, when we are prescribing testosterone to a male, we need to be treating the female as well. Yes. And also to be aware and counsel our patient that testosterone is mind altering. Physiology drives behavior. And so if all of a sudden we go from a very low testosterone, and this is true in women too, we go from a very low testosterone to a very high testosterone, we have thrill-seeking behavior, right? Dopamine-seeking behavior. We get thrill-seeking behavior. So there's that tendency to look outside of our relationships. And I always remember counseling a couple in sexual health and hormone balance, and I prescribed the spouse some testosterone and prescribed him some testosterone injectable. And I said, well, we'll follow up in 4 to 6 weeks, but let me know how you're doing. And if you feel, and if you're thinking differently, if you're, in any way that's out of character, let me know. And he called me up 3 weeks later and he said, Dr. Anna, I'm thinking thoughts of someone else that's not my wife that I shouldn't be thinking. I don't want to be thinking. And I said, well, let's run your labs right now. Let's take a testosterone holiday for the next 3 days. And it turns out he was actually misdosing his testosterone injection. So we were able to see that his testosterone was up over 1,000 and not my optimal range, which is 600 to 800 that I like to see for optimal function in life. So it was beautiful that, that he caught that. But one of my criticisms on our anti-aging colleagues is the high rate of divorces in their practices. And that's not what we're after. That's not what we're after. No. And so we want that balance. We want to restore relationships, rekindle that. And we can't do it if we're only treating one member of the couple. So for women's health, vaginal issues, loss of pleasure, decreased sensation, irritation after sex, burning, discharge, urinary infections, odor, all those things are such negative feedback that we don't even realize it's causing us not to want to initiate sex, let alone be receptive to sex at all. And so I always tell clients, well, I mean, seriously, if you were a baseball player and you go up to bat and every time you go up to bat, you're going to get hit by the ball. I mean, seriously, would you want to play baseball? No, right?
What a great analogy.
Never. Like I'd be out after the first game. Hell, I'm not going back there.
The first time I heard you lecture, this was a little while ago, I think when you were still 35, about 4 years ago.
Right.
You had talked about this, and I went back to my clinic, and I had a man who we had optimized his testosterone, and he was very happy. He told me how great things are, but he came back in with his wife for the follow-up. And while he was in the bathroom, she said to me, I am miserable. I had a surgical hysterectomy. I have no estrogen. My vaginal mucosa is super dry, and intercourse is painful, but I do it to please him. And so that really, based on your talking to me and me with that experience a couple of days later, I always now treat them together. I ask them to bring their spouse in, bring their partner in. It's got to be a two-way street. We can't support the man's sexual health and ignore the women's. I think that happens a lot.
It happens a lot, and women are just powering through it. I want it, like I'm doing my duty. I want him to be happy. I want him to have pleasure. Well, I always tell clients, his pleasure is your pleasure. If you're not having pleasure, he's not going to have pleasure. So you've got to do it for you. And so that's one of the reasons I created Julva, my anti-aging cream for the vulva. That's just been rejuvenating to keep our tissue elastic. And we've getting, you can just read the reviews. It's just amazing how that's affected women's lives and changed lives, and in a way that's all natural, no synthetic, no GMO, no parabens. And it's, so that's been a key thing, because after retiring my practice in 2015 and I wanted to continue to help women in this space, especially as I educate online. And it's been a beautiful solution, because, and the other thing I do is train doctors for those vaginal hormone prescriptions, because it's easy.
Yes.
It's easy and so helpful. And not only are we even talking sexual health, but urinary incontinence,
yes,
prolapse, pressure, pelvic discomfort, all those things that can be improved by keeping that tissue as healthy as possible. So bravo for you doing that.
I think a lot of physicians and women don't realize that vaginal vault has to stay moist and healthy, and that mucosal lining be plump and healthy to prevent also urinary incontinence issues, to keep the bladder healthy urinary. And again, it's really the whole body. I love how you talk about connection, Anna, and really the partners connecting together. And helps with the oxytocin, and it's all helping with the lifestyle. What are some of the pearls that you would share with our viewers about helping them connect with themselves, their friends, their partners, their family? Do you have some good connection pearls for them?
Oh my gosh. I think one thing is, as women, we tend to be hard on ourselves. So first thing is, get that nasty witch off your shoulder, right? I want to say that, that little evil woman there just who's nagging at you, talking negatively at you, you've got to knock her off, and then fight back with being your own best coach, your own positive coach. And I give the example, Mark, about my tennis coach, and I, would go and I'm determined to one day be a good tennis player. And out of the 99 things I'm doing wrong, he finds the one thing I'm doing right and will focus on that, right? The one thing. And that's for us too. What is even starting, hopefully we have hundreds of thousands of things that we love about ourselves, but sometimes it's just starting with that one thing, oh my gosh, okay, love my smile, love my hair, love my family. What is it that we can love and take ownership of that's from our creation, and focus on that too, because connecting to ourselves, to our feminine, and that self-love, from there we can overflow in a beautiful way, giving to our families, our kids, and they'll extend that beyond us. So, but it starts here. And I'll say it starts here with the Holy Spirit within us teaming up and creating this overflow of love and joy. And it's a practice and a discipline, at least for me.
Isn't that why women live longer? Is because they're more social beings than men are? There's something about that connection.
Oxytocin.
It's got to be a big part of this for sure. Our mutual friend Mark Hyman spoke at the International Congress 2 years ago now about the carrot and the stick, that evolutionarily we're wired that we will lay in bed and not praise ourselves for the 10 great things we did that day, but ruminate on the one thing we did wrong. Because we're hardwired as cavemen and cavewomen, because we'll find another carrot tomorrow. So we don't praise ourselves for the good things we did. But if we get hit by the stick today, there's no tomorrow. So we focus on the negative that happened to us, not the positive. And I think a lot of us do that. And I do think that there's more pressure on women than ever before to be successful, to be a super mom, to be as good as they can be. The average woman leaves the house with 120 toxic chemicals placed on her body. Our environment's being harder for women. Our society's harder for women. We talk about toxicity and hormone health and toxicity and heart health. Do you have ways to assess that in your clients and also ways to help them to avoid it? Reading labels, your products are excellent. You've really focused on that in your product line. What are some good tools you'd share with that?
Oh my gosh, definitely detoxing on a regular basis. But I just want, before I go there, Mark, I just want to touch back on what you said, because you said women are harder on ourselves than ever before. And I just think, the media imagery, like we see these great looking gray foxes, right? Silver haired foxes. And with like a woman 30 years younger, I'm like, okay, well, where's the rest of us in this picture, right? Over 50, I'm 52 with a 10-year-old, right? And so you're faced with those media imagery and like almost there's a whiteout unless we're being sold something.
Oh, interesting.
So it's really interesting. So I just in like my work in my Magic Menopause community, my online community of women, is like to raise this all up together, because the women that have created such social change over the millennia are women, past childbearing years.
Mm-hmm.
Past childbearing years. So we want to, I want to encourage, like we have many purposes in our lives. It's a continual redefining. So to encourage all women to, like, number one, like shut out that imagery, and then just really connect into your source. And I think that's the first thing, to clear the mental toxicity that we're being ridden off, let's clear that mental toxicity. And then from the environmental perspective, it is, really, like I will say with products, if you can eat them, you can put them on your body, right? So, but then again, there's some, we want to just really look at clean products. So paraben-free products are really important. And I always send my clients, if you got a favorite product, look at ewg.org /skin deep and look at the rating for that product. And let's choose the safest ingredients. Funny story. My daughter, who is now 10, because she would die if I told this story, but
I won't tell her.
Don't tell anyone else, right? So she came to me and she's 10. She's a young 10. She's like, the smallest in her class, just petite, just this really young 10. And she's like, Mom, everyone, I want deodorant. I'm like, why do you want deodorant? Because the girls in her class now in 5th grade, they're getting deodorant and all this other stuff. And I'm like, deodorant, let me smell your underarms. No, you smell sweet. You don't need deodorant. And she's like, Mom, I just want deodorant. But not with aluminum, she tells me. But not with aluminum, Mom. I'm like, at least she's listening to something, right? So I was really excited about that. So I'm like, okay, well, here's my drawer of deodorants. Here are 3 that don't work. Here's one that worked, but they're all natural.
So what is the problem with aluminum? Because I just switched about a year ago to a natural one.
Well, good. I mean, I think we know that aluminum is present in breast cancer, right?
Yes.
And so it's one of those hormone disruptors. It's a toxin to our body, a heavy metal toxin. So we have to be conscientious of cutting out the aluminum. And I think that does help. And apparently our kids are finding out about that too. So that's really good.
So, we started our discussion talking about heart symptoms and menopause. And one of the things I see in men and women is they get this fatigue that is kind of unexplained, and it gets chased down as a depression issue or some other psychosocial issue, when it may be a hormonal issue or a cardiac issue. So one of the scary things with heart disease is that it starts to slow you down as your heart starts to lose its optimal function. How do you assess women in the menopause time, and really be sure that you're kind of covering all the bases with the hormone, with the heart, with the brain, with the vaginal health. How do you tie all that together for people, Anna?
Yeah, I think that's again, it's the taking a holistic approach. I think the first thing that I always do is have them do my hormone toxicity questionnaire. I want just that assessment. Let's see where you are, and don't even worry about where you're starting or what that number means. Let's just interact from our head to toe approach to get that number down to 0. Let's just start improving that number. And we know that we can reverse heart disease by taking a functional approach. We know that, hormone balance helps improve our cardiac output. We know that, the more we exercise, we're going to improve our cardiac function, but we've got to do all these pieces together. So I think for me, it's always this head to toe approach. I have a 7-step assessment, this head to toe approach. And really a big part of that is regular detoxification, because even the best intended of us are exposed to a significant amount of toxins. So daily detoxification, my practice, we do it with modified elimination diet, my extra supplement support, so my Mighty Maca Plus supplementation, and maybe we need additional phase 2 detoxification support that can really help. And I think regular detoxification is one of the way to, it's like a tune-up, like what do you call it, an oil change, like getting just that regular maintenance.
Well, I don't know if a lot of our viewers know, but you traveled the world working with indigenous healers and looking at other cultures and other medication programs, and you really came back with some pearls, and you've taught me about Maca. And I still think you have the best Maca product on the planet.
I do.
Can you tell our viewers about Maca? What's magic about it, and what do you got to watch out for? Because there's bad Maca out there too. And how do you see it as integral to overall women's health?
Yeah, I've used it now for almost 10 years. We're coming on our 10th year anniversary of Mighty Maca, and it is I learned about Maca in my journeys, like you said, around the world. And one of the first stops was in Peru. So in traversing to Machu Picchu and the highlands of Peru, found whenever you would say, I'm tired, well, they say, well, have some Maca. Or, you're infertile, have some Maca. Your baby's not thriving, have some Maca. And then they elbowed my husband, say, oh, it's the Peruvian Viagra. Gotta love that, right? And of course, as a scientist, I'm like, well, what makes this wonderful? Yeah, like what makes this wonderful? And maca in itself is a cruciferous vegetable. So, gosh, we love that for the breast, right? So right away, we think of that. It's in the cruciferous family. It's really like a root, a really ugly root, but it also has macaine, specific proteins that aren't found in anything else, and only found in these highland regions. So Chinese maca is not the same.
That's an important comment. It's not just the maca, but the kind of maca, where it's grown, who makes it, how clean it is. That's a great point.
Yes. And it also has high levels of arginine. Well, arginine, increases nitric oxide. And so that's how Viagra works. So hence, like, oh my gosh, okay, that can substantiate some of its claims, but I hated taking it. I mean, it just tasted terrible to me. And so I, as like my chef-ish background, like loving to make things taste wonderful, it's kind of like the Mary Poppins in me, right? So just make it taste better. Just started incorporating other healing foods from around the world. And that's where the combination in my practice, I will say that it works better than any single ingredient by itself. And that synergy of the world superfoods that I put together in Mighty Maca Plus, which is my formulation, that's made a difference. And I've seen it for estrogen detoxification, seeing estrogen detoxification numbers improve, seen it for blood sugar, decreasing cravings, all those good things and hot flashes, killing those hot flashes. So it can see that the combination, it works that way. And I use only organic maca from Peru. And I think that's really an important part too. So, and that we want to keep it sustainable. So I think in everything, because maca is a limited resource, we want to be conservative in how we're using it. And if we can create some synergy around it, that's even better.
We know this concept of sustainable sourcing of products, and You know, what I love about you, Anna, is you're a scientist, Emory graduate, triple board certified, but you saw something in the ancient culture and you listened. You heard this being used at so many places. And I love when ancient wisdom gets brought into modern culture the right way, in an organic, sustainably sourced, from the right place, with the right intention, used in the right way for the right people. It's a great story, but it's successful. And I really encourage everybody to take a look at that. Are there other super products or super supplements that are really exciting that you're working on now?
I am. I have my Mighty Maca Plus and I have my Gel Vat, and I'm excited about both of those. Those are just been amazing. But I'm also making a keto green smoothie with 0 gram sugar, monk fruit sweetened. So I've been working on tweaking that for the last year. So that's going to come out. I'm excited about that too. And just really excited about my book coming out.
Well, tell us about your book.
So my book is called The Hormone Fix: Burn Fat Naturally, Sleep Better, Stop Hot Flashes, and the Keto Green Way. So it includes food plan, and it's just not just about what we eat. I will say diet is 25% of our whole picture, but the lifestyle, the keto green lifestyle that I've incorporated into my programs and can really make a difference in I would say our menopausal population is one of our most challenging health populations. This is where things are starting to go bad fast if we don't turn, if we don't make that turn, if we don't intervene in the right way. And so that's been my passion, and that's what I've written about in this book, and just natural ways, predominantly natural ways to solve that and to improve our health.
One thing I remember you telling me about are some of the small groups of women that you work with, or you bring women together and you help kind of guide them on a journey together. That must be so fun and rewarding to work with a group of women and seeing them connect.
I love that. I think there absolutely is 100% therapy in community, and we can do it locally and we can do it now virtually.
Mm-hmm.
And like how we're connecting right here, you in Wyoming, me in Southeast Georgia, and encouraging these relationships really does improve our overall health and well-being, and sense that we're not alone, which is so important.
And if there was one tool or pearl that you would love the women viewing today to take away from our talk, what would that be?
I would say, just very simply, is not to give up on yourself. See yourself 10, 20, 30 years from now in that ideal state, in a loving relationship with your family, friends, community around you that you've contributed to. You've been part of their life. They've been part of yours. And everyone's thriving. You are healthy and optimal and just radiating health. See that vision of yourself and just keep following it. Keep following the next right step, one at a time, to get there.
And Anna, our viewers can follow you on drAnnaCabeca.com and connect with you on Facebook, Twitter, and Instagram. How do they find you there?
Yeah, so just find me at dranna.com. So very easy, DRANNA.com.
Fantastic. Dr. Anna Cabeca, thank you so much for joining us today.
Thank you for having me.